You pay only your plan premium if your annual income in 2016 was $85,000 or less for an individual or $170K or less for a couple. If you reported a modified adjusted gross income of more than $85,000, individuals and married individuals filing separately, or $170,000, married individuals filing jointly on your IRS tax return 2 years ago, the most recent tax return information provided to Social Security by the IRS, you'll have to pay an extra amount for your Medicare prescription drug coverage called the Income-Related Monthly Adjusted Amount, IRMAA. You may pay this extra amount in addition to your monthly Medicare drug plan premium. If your income has gone down due to any of the following situations and the change makes a difference in the income level Social Security considers, contact them to explain you have new information and may need a new decision about your IRMAA. So if you married, divorced, or became widowed, you or your spouse stopped working or reduced your work hours, you or your spouse lost income-producing property due to a disaster or other event beyond your control, you or your spouse experienced a scheduled cessation, termination, or reorganization of an employer's pension plan, or you or your spouse received a settlement from an employer or former employer because of the employer's closure, bankruptcy, or reorganization. Medicare drug plans cover generic and brand-name drugs. To be covered by Medicare, a drug must be available only by prescription approved by the U.S. Food and Drug Administration (FDA), used and sold in the United States, and used for medically accepted indication. Medicare covers prescription drugs, insulin, and biological products, for example, antibodies, proteins, and cells. Medicare also covers medical supplies associated with the injection of insulin, like syringes, needles, alcohol swabs, and gauze. To make sure people with different medical conditions can get the prescriptions they need, drug list formulary for each plan must include a range of drugs in each prescription category. All Medicare drug plans generally must cover at least 2 drugs per drug category, but the plans may choose which specific drugs they cover. Coverage and rules vary by plan, which can affect what you pay. Even if a plan's prescription drugs list doesn't include your specific drug, in most cases a similar drug should be available. If you or your prescriber, your doctor or the healthcare providers who is legally allowed to write prescription, believes none of the drugs on your plan's drug list will work for your condition, you may ask for an exception. Medicare drug plans must cover all drugs in these 6 protected categories to treat certain conditions: cancer medication, HIV/AIDS treatments, antidepressants, antipsychotic medications, anticonvulsive treatments for epilepsy and other conditions, immunosuppressants. Also, Medicare drug plans must cover all commercially available vaccines, including the shingles shot, but not vaccines covered under Part B. Any doctor or other eligible professional who prescribes Part D drugs must either enroll in the Medicare program or opt out to prescribe drugs to their patients with Part D plans. Medicare Part D may no longer cover drugs that are prescribed by doctors or other eligible professionals who aren't validly enrolled or opted out of Medicare. All prescribers should enroll in the Medicare program before August 1, 2016 to allow for processing of applications and to ensure enrollees to get prescriptions, and I believe that applies for 2017 year. This includes eligible professionals such as dentists, doctors, residents, psychiatrists, nurse practitioners, and doctor assistants. Dentists, including oral surgeons, won't be able to participate in a Medicare Advantage plan if they choose to opt out of Medicare. Upon submission of an opt-out affidavit, a provider has 90 days to change their opt-out status. After 90 days, the provider isn't able to terminate their opt-out designation and will remain in an opt-out status for 2 years. By law, Medicare doesn't cover these drugs. Drugs for anorexia, weight loss, or weight gain, even if used for a non-cosmetic purpose like morbid obesity, erectile dysfunction drugs when used to treat sexual or erectile dysfunction, unless such drugs are used to treat a condition other than sexual or erectile dysfunction for which use the U.S. Food and Drug Administration approved the drug. For example, a Medicare drug plan may cover an erectile dysfunction drug when used to treat an enlarged prostate, also known as BPH. Fertility drugs are not covered. Drugs for cosmetic or lifestyle purpose, for example, hair growth. Drugs for symptomatic relief of coughs and colds. Coughs and colds. Prescription vitamin and mineral products, except prenatal vitamins and fluid preparations. Non-prescription drugs are also not covered. Plans may choose to cover excluded drugs at their own cost or share the cost with you. Let's move on. Medicare drug plans manage access to covered drugs in several ways. These are known as coverage rules. This includes prior authorization, step therapy, and quantity limits. You may need drugs that require prior authorization. This means before the plan will cover a particular drug, your doctor or other prescriber must first show the plan you have a medically necessary need for that particular drug. Plans also do this to be sure you're using these drugs correctly. Contact your plan about its prior authorization requirements and talk with your prescriber. Step therapy is a type of coverage rule. In most cases, you must first try a certain less expensive drug on the plan's drug list that has been proven effective for most people with your condition before you can move up a step to a more expensive drug. For instance, some plans may require you first to try a generic drug, of course if it's available, and then a less expensive brand name drug on their drug list before you can get a similar, more expensive brand name drug covered. However, if you already tried a similar, less expensive drug that didn't work, or if the doctor believes that because of your medical condition it's medically necessary to take a step therapy drug, the drug the doctor originally prescribed, with your doctor's help, you can contact the plan to request an exception. If the request is approved, the plan will cover the originally prescribed step therapy drug. For safety and cost reasons, plans may limit the quantity of drugs they cover over a certain period of time. If your prescriber believes that because of your medical condition a quantity limit isn't medically appropriate, you or your prescriber can contact the plan to ask for an exception. If the plan approves your request, the quantity limit won't apply to your prescription. Each Medicare drug plan has a formulary, which is a list of prescription drugs that it covers. Each formulary must include a range of drugs in the prescribed categories and classes. To offer lower cost, many plans place drugs into different tiers, which cost different amounts. Each plan can form its tiers in different ways. Here's an example of how a plan might form its tiers. So for example, Tier 1 generic drugs, less expensive. Those are the least expensive. Tier 1 drugs are generic drugs and are the same as their brand name counterparts in safety, strength, quality, the way they work, how they are taken, and the way they should be used. They use the same active ingredients as brand name drugs. Generic drug makers must prove that their product performs the same way as the corresponding brand name drug. They're less expensive because of market competition. Generic drugs are thoroughly tested and must be approved by the U.S. Food and Drug Administration (FDA). Today, almost half of all prescriptions in the United States are filled with generic drugs. In some cases, there may not be a generic drug available for the brand name drug you take, so you have to talk to your prescriber. And the second is the Tier 2 preferred brand name drugs. Tier 2 drugs cost more than Tier 1 drugs. Tier 3 non-preferred brand name drugs. The Tier 3 drugs cost more than Tier 2 drugs. And Tier 4 or specialty tier. These drugs are unique and have a high cost. Want to make a note that in some cases, if your drug is in a higher or more expensive tier and your prescriber thinks you need that drug instead of a similar drug on a lower tier, you can request an exception and ask your plan for a lower copayment.